HEEADSSS is a way of getting a comprehensive picture of a young person's world.
It's a psychosocial screening tool, so you're talking about the things that influence people's lives.
More often than not, the young person will come in with one issue, but as you're having that conversation, you'll realise that there's a whole number of contributing factors that maybe even the young person isn't quite aware of.
When HEEADSSS conversations with young people are crucial.
I was quite a junior doctor working in an emergency department, and there was a 14-year-old girl in a bed with an oxygen mask on with a diagnosis of asthma. I started talking to her, started to take a HEEADSSS history, and I think that engaged her in a conversation. By the time we got to talking about sex, she actually admitted to me that she thought she was pregnant, or she just found out she was pregnant. She was having a panic attack and hyperventilating, and that's the reason she'd come into hospital. So we were able to actually change tack and, give her the treatment and the management that she needed.
Often I'm going to be the only person who's going to directly ask those questions of that young person. And then if I get answers, I have the capacity to act, and act in a timely way.
The thing about working with young people is that it's important to engage them in a conversation.
Sometimes a young person might not have the tools to communicate what's really going on for them.
I always find it important to build trust and to have engagement. I think that's actually should be the first goal when you're seeing an adolescent patient. So you feeling okay?
Yeah, I'm a bit anxious.
Yeah, feeling a bit nervous. That's understandable. You don't know me. First time we've met. Yeah, that's all right. So you happy if I ask you a few questions?
Yeah.
Of course, HEEADSSS is actually more than that. It's about assessing risk and protective factors, because the health problems of young people are often around health risk behaviours.
So by having that conversation, you're kind of able to bring that out while building the relationship at the same time.
I think there are barriers at different levels.
A lot of workers feel stressed, pressed for time. How can I have a conversation when there's 10 million things in the back of my mind that I need to do? Often
for general practitioners, they have long lists of people who are waiting to see them. Everybody's urgent.
But you don't have to do it all at once. You can start, move around in it, come back to it at another time.
Just taking 5 minutes to finish 2 of the questions, knowing that it can be a work in progress.
Clinicians often worry that by the time they get to some of the more sensitive parts of HEEADSSS that they're going to open a can of worms, that they might not be equipped to actually deal with what the young person is going to reveal. And it can create a lot of anxiety on the part of the clinician. And there's often a concern to get to the presenting problem, to deal with the presenting symptoms and get to a diagnosis, rather than taking a step back and saying, well, let's broaden the line of inquiry here.
But I think the important thing to remember is that I think the biggest barrier is in our own heads. And that's not a pun. That was a pun.
So if you're getting ready to start having a HEEADSSS conversation with a young person, it's really important for clinicians to be aware of how they're feeling.
So make sure I'm in the right frame of mind, acknowledging what you're not comfortable with. So it might be that before you even ask the questions that you might need to go away and do a little bit of research or discussion with your peers first.
I think it's always important as a clinician to remember truly what adolescence was like. Not knowing what you wanted to say, being worried what you might sound like, all that self-consciousness, embarrassment of being an adolescent, and the sensitivity and the need for privacy. I think it just reminds us to not push too hard.
You need to take into consideration what is actually happening around you and what's happening around the young person in whatever setting you're in. And to make sure people are comfortable, it's best if you can make it private.
Create a warm and welcoming and trusting place for the young person and for yourself as well. Because once you've done it once or twice, it actually can become absolute second nature when you're talking to a young person.
The next video is what a young person may bring to the conversation. It covers stages of adolescent development, if trauma is disclosed, what to do, identifying protective factors, and approaches for different stages of development.